Dr. Ahmed Mukhallalati is the former head of the burns unit at a Shifa hospital in Gaza. The hospital was completely destroyed a year ago following a siege by Israeli forces. And Dr. Mukhallalati joins us now live from Dublin. Good to have you with us. So, first of all, take us through, Doctor, what it was like to work in a burns unit of a hospital that's in a very densely populated area, under decades of occupation, siege, under attack, and under what UN special experts and rapporteurs describe as a genocide.
Thanks for having me. It's something unbelievable. Even you can't imagine what's happening. I will tell you, for the first month, I just collected the data, what we had. We had more than 100 patients with burn, extensive and deep, more than 30% of the body surface area. In the usual circumstances, we get the patients above 50% with very low chances to survive. But what happened during that war, that in most of the patients, even with as low as 30%, we were losing the patients most of the time. I can remember out of the 98 patients we had in the first month, we had only 3 survive with burn more than 30%. It is not killing the people directly by the burn. The burn needs a lot of care, a lot of intensive care after that. Operating theaters, it needs very clean, sterile environments to avoid the infection, because simply you are dealing with a patient with no skin in most of their bodies. So they need a lot of care, which is when you overwhelm the system by getting hundreds of casualties every day, you can't tolerate this number, and then you end up losing most of the patients. So we're not providing proper care of burn patients at all. We were trying just to get whoever in front of us to have a surgery, maybe 1 out of the planned 5 surgeries they will get. There is no operating theaters. So it's totally difficult in all means to be able to treat these patients at all. Maybe I would just say something about the weapons. Everyone knows that Gaza is a weapon testing field nowadays. So they use what we call thermobaric weapons or fuel air weapons. These are weapons, they work simply by creating a cloud of fuel in the air and then igniting that, which ends up in a very big explosion with high temperature, high pressure. These internationally prohibited weapons, which should not be used at all in civilian areas, are the standard of the weapons they use. So you get a lot of casualties with extensive burns, very deep burns, and you end up with that big number of burns. Adding to this, now with the tents, in most of the areas in Gaza, and most of the people lost their houses. They live in tents, which is easily could be part of the fire creating fuel, and then end up in a longer fire and more deep burn, which happening now in Gaza. So it's really very hard, very difficult, even to imagine the hundreds and hundreds of continuous burn casualties we receive in the hospitals.
And while you were talking there, I think we were running pictures that of you in Gaza at the time when you were there, able to operate at some level or capacity in the hospital. And some of those photos, I mean, it looked like a lot of your colleagues were on the floor, sitting on the floor. Just talk to us about what the conditions were like in terms of equipment. Did you have the right equipment? Were you able to sterilize? Were you able to use them in the correct way? Did you always have electricity or fuel and so on?
To start with, I've worked for maybe 9 months in these circumstances. So the burn units in Gaza used to be 2 burn units, one in Shifa Hospital, one in Nasser. The Shifa Hospital unit was out of service by the end of the 2nd month of the war. So we lost the major burn unit. So we had no specialized burn services at all. That's one thing. The other thing, because of the continuous casualties, you didn't get access to operating theaters at all. So instead of doing the dressing and the wound cleaning and washout debridements in operating theaters, you have to do them in the ward in totally non-sterile, unclean circumstances, which adds a lot of the challenges you face with the wound infection. And then we had very crowded hospitals with a lot of people sheltering within the hospital. They have no houses to stay there. The toilets, the facilities were overwhelmed with the number of people. So we had a lot of flies, maggots in the wounds all the time. So the infection was very high in all the wounds. The other thing which we suffered of is just not having ICU beds enough to tolerate this big number. So in the usual burn care, any burn more than 25-30%, you get them into the ICU to have proper specialized care so they survive this. We lacked all of the ICUs. So just few weeks ago, we had the ICU units reopened in the north of Gaza. Before that, for many, many months, we had no ICUs in a Shifa hospital or Al Ahli hospital or any of the hospital in the north. So we had to deal with all of these things with no ICUs. Instruments, dressings, we had to use sugar, we had to use vinegar, we had to use whatever in front of us because we had nothing. You can not tolerate this big burns with lack of resources, lack of instruments. All of the aid has been stopped for more than 2 months now. The people, the doctors, the nurses there are really suffering with finding the basic needs. Adding to all of this, many of the plastic surgeons either killed or pushed to leave the country and they couldn't go back. And adding to this, all of the international visitors would face the high chance of being rejected and not allowed to get into Gaza. They allow the humanitarian workers who are non-medical, the security people, the people working in the logistics, but not the surgeons. Only few surgeons are allowed to get in Gaza now to support the health system, which is collapsed in all means.
All right, thanks so much. Dr. Ahmed Mukhallalati, former head of the burns unit at a Shifa hospital in Gaza.
Thank you.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.